after surgery, as discussed, you will have pain. There's different ways to manage that. We don't want you to be pain-free because you do need to let pain be your guide. And if you're not having enough pain, you might be doing more things than you should be. Typically, your surgeon will prescribe some type of narcotic medication and maybe a muscle relaxer to go along with it to keep your pain under control. Those are medications that you need to take as prescribed. If you do not feel that your pain is adequately covered, you need to let the office know. Sometimes we'll use anti-inflammatories after surgery, but there are certain surgeries where your surgeon is not going to want you to use anti-inflammatories because of healing that is needed to be done intracellularly for bone growth after surgery. So make sure you talk to your surgeon about whether or not you're able to take anti-inflammatories. And this would include basically everything over the counter except for Tylenol. And there's several prescription anti-inflammatories that you should avoid as well if that is the case. Ice is okay to use over your incision, over your pain, whether it's between your shoulder blades or over the back. That is fine after surgery. Heat should not be used over the incision. If you have pain between the shoulder blades without your incision being there from an anterior cervical fusion, you can use heat there, but for the lumbar spine, you really need to avoid that. If you have any questions about whether the level of pain that you're having is normal, if you're having new significant weakness or numbness in your extremities, that is a time that you need to let the office know. So after surgery, walking is encouraged. We want you to get up throughout the day. It hurts to move and we understand that, but sitting in bed is not ideal either. It's going to make you more sore if you sit for too long, if you lay in bed for too long. So we do want you getting up several times throughout the day. You don't need to walk a marathon or anything, but multiple short walks throughout the day are encouraged. The amount of walking is different depending on the patient. So if you walked a lot before surgery, you're going to be able to walk farther longer after surgery. But if you're someone who's been really restricted by your activity because of the pain before surgery, don't expect to suddenly walk, the 5 miles that you used to walk 2 months ago. You have to give yourself time to get there and know that as you're doing activity, you may not be feeling that you're doing too much until hours later the next day. And then it's going to be hard to move and get out of a chair and get out of bed. So you need to slowly increase your activities. Let pain be your guide. For cervical spine surgeries, we want you to avoid any heavy lifting, and by heavy lifting we define that as a gallon of milk. No pushing and pulling with the arms, and no overhead work or overhead reaching. For lumbar spine surgeries, it's BLT, no bending, no lifting, no twisting. Again, gallon of milk is what we define as heavy lifting, so not a whole lot. And that's typically for about the first 3 weeks after surgery, and then you'll see your surgeon at that point, and they'll let you know what you can do at that point. We do think that stairs are fine to do. Just go slow. Don't try to push yourself, but there's no restrictions with stairs. And driving can typically be resumed about 1 to 2 weeks after surgery. You want to check with your surgeon to see if you would have anything different depending on what you had done. For lumbar spine surgery and for cervical spine surgery, we don't want you taking any narcotics before you drive. We don't want your pain to be distracting you while you're driving. And specifically for surgeries on the neck, you need to be able to turn your head enough to check your blind spot before you start driving. Also for cervical spine surgeries, turning your head left and right is okay to do that slowly after surgery, but what we want you to avoid is looking up and looking down for extended periods of times or repetitively.
So after surgery, it's definitely best to just stick with simple foods. For that first couple days once you go home, sometimes people are somewhat nauseated. It can be from the anesthesia that's used during surgery. It can also be from the pain medication, the narcotics that are used. In general, people can have difficulty with swallowing, worse with neck surgeries, especially the anterior neck surgeries that we do. So you want to stick with softer foods that are easier to swallow. If it's really painful, try cold foods tend to help. Definitely drink water when you're eating. Make sure to take small bites. You should be able to swallow liquids and you should be able to swallow pills without difficulty. So for some reason, if you develop problems with that, we would want to know about it, okay? The difficulty with swallowing, though, isn't always isolated to neck surgeries. Sometimes people with lumbar spine surgeries can also have problems with swallowing just because there's a tube down your throat to help you breathe. during the surgery itself. So your throat may feel scratchy. So again, stick with soft foods, but it's usually not an issue after the first couple days. Another common thing that people often contact us about is constipation. Constipation is relatively common after surgery. Again, it has to do with the anesthetics that are used during the surgery itself. It also has to do with the pain medications that are used after surgery, particularly the narcotics. Biggest way to probably prevent constipation is not overusing the narcotics. Also drinking drinking 6 to 8 glasses of water per day is what we would recommend with that. Eating foods that are high in fiber, getting up and taking short walks can also help promote regular bowel movements. Now, if you were to develop constipation or you're prone to it, we would definitely recommend that you get an over-the-counter stool softener. So sometimes we talk to patients about actually getting it before surgery, having it there if they were to need it after surgery. Some patients even need to take the stool softener just regularly, daily, if they're still on their narcotics. So there's different types you can ask a pharmacist about. Senokot and Miralax are the most common ones that we hear people use. If you've had one that's worked well for you in the past, so you can absolutely use that as well. If you have not had a bowel movement, though, 3 to 4 days after surgery, we would definitely want to know about that. You may need to get an over-the-counter enema or suppository, but we can talk about that further if you contact our office.
You'll have a dressing over your incision after surgery. That will typically come off on postoperative day 2. If you're still in the hospital, we'll take it off before you leave. If it's an outpatient surgery, you'll take it off yourself at home. If there's any drainage from the wound, any swelling, any redness, you want to call our office and let us know that. You can shower 2 to 3 days after surgery. If you had a drain in, you can take that, you can shower the day after your drain was removed. If you have staples or non-dissolvable stitches, then you will need those removed 10 to 14 days after surgery. Most incisions are closed with dissolvable stitches that will either have steri strips or skin glue on top of that, and those will typically come off about 7 to 10 days after surgery.
So first of all, not everybody is going to need a brace after the type of surgery that they have. If you do need a brace after a neck surgery, the most common type of brace that we use is this soft cervical collar that's here. It'll be given to you before you go home. It's often for comfort is why you need to wear it. So it has Velcro on the back that you can open it up. There's a divot that your neck will fit into, and then you can just Velcro it from behind. Sometimes people will also need an extender. An extender is an extra piece of Velcro on the back, and that'll be given to you when you're in the hospital as well. Over the top of it, there is a cover that's here. This is completely removable. You can remove it and wash it. It's just for sanitary reasons only. If you need a brace after your lumbar spine surgery, this is the most common type of brace that we use for that. It's a hard lumbar brace. It has Velcro in the front that you can open up, place it on your back. You close it with these bigger Velcro pieces, and then there's smaller pieces here that you can just open up and tighten once you have it on. You need to talk with your physician to see how they want you to wear this brace, whether or not it's just when you're up doing activity or if they want you to wear it at all times. We definitely want you to contact our office if you have pain that's not well controlled with the pain medication that you were sent home with. We also want to know if you have any new weakness that would develop in your arms, especially after a cervical spine surgery, or legs after a lumbar spine surgery. If you have any fevers or chills, we would need to know about that as well, especially if your fever is over 101 degrees. Again, it's not necessarily related to the surgical site itself. Oftentimes it's related to lung problems or breathing kind of difficulties that you may have after surgery. If you have any incisional drainage, we should know about that. Incisional drainage a few days after surgery is somewhat expected. Oftentimes there's dried blood on the dressings when you remove it. But if you were to develop drainage that lasts for more than a couple days after surgery, if it's excessive drainage that it's saturating your shirt or saturating your sheets, if it smells kind of funny, we would want to know about that for sure. The last thing that people often contact us about is if they have issues with urinary retention. Urinary retention can be relatively common after surgery, especially for men, and it's related to the anesthetics that are used. So if you have not been able to go to the bathroom for about 8 to 12 hours after surgery or after you've been home, definitely contact us regarding that as well.